I'm Dr James Thompson. I'm a urologist and robotic surgeon in Sydney. Today we're talking about haematuria. Haematuria is a medical term which means blood in the urine. It can be visible with the naked eye, sometimes so subtle that it's only visible under the microscope. Either way, it's important. The good news is that the most common causes are simple things such as an infection, kidney stones, or benign enlargement of the prostate in men. Occasionally, blood can be a symptom of something more serious, for example, cancer of the bladder or kidney. This is uncommon and found in less than 1 in 20 cases of those with blood in the urine. Our assessment starts with a detailed history of all your urinary symptoms and the blood, as well as a full past medical and surgical history, followed by a physical examination. Next, we perform some urine tests. We test the urine to rule out an infection and to do cytology, which is where we look under the microscope for cancer cells. We'll also perform some blood tests, checking the kidney function, your blood clotting, and PSA, which is a prostate cancer screening test in men. We then perform a special CT scan using an injection of dye into the vein to provide a clear outline of the kidneys, the ureters, and the bladder at the bottom. The final, but perhaps the most important test, is called a cystoscopy. This is where a urologist gently passes a small fibre optic camera in through your urethra, the tube from the outside into the bladder. This way we can see inside the body to examine the inner lining of the bladder, the urethra, and the prostate in men. We can perform a cystoscopy either in the office under a local anaesthetic, if that's your preference, or if you prefer, we can do this while you're asleep under an anaesthetic in the operating theatre. After completing all these tests, often all that is required is reassurance, because the good news is that no underlying abnormalities found in around half of cases. At this point, most people simply require a once-a-year urine test by their GP to see if there's any sign of blood. If the urologist suspects there may be an inflammatory condition of the kidney, we will refer you to a kidney physician called a nephrologist. Referral back to the urologist by the GP is only required if the blood persists on an annual test for 3 years, or if the bleeding becomes worse or other symptoms develop. If you have blood in your urine or any other new urinary symptoms of concern, please don't hesitate to see your GP, because you may need referral to a urologist so that we can perform a full and detailed assessment and check that everything's okay. For more information, please see our website or watch our other videos. Thanks for watching.